Hello everyone, beautiful Unacademy NEET PG platform, and today's topic of choice is nothing but celiac disease. Before starting this beautiful video, please let me know if my solitary voice is audible to everyone. Hello Dr. Vandit Shah, hello Swaraj. Good evening everyone. If my voice audible to everyone, we're gonna start this beautiful class, 30-minute quick session on celiac disease. Let me know if my voice is audible to everyone. This is the beautiful Unacademy NEET PG session. And my name is Dr. Anand. I'm working in a medical college as assistant professor. And let's start. So yes, my voice is audible to me. I assume it's audible to you. Yes. Hello Shagufta. Hi Manoj. This class is exactly for packed 30 minutes. 9:32. I will make you free. Okay. So number one, I hope yesterday you have given this test of the NEET PG 2022 All India mock test. Also on the Unacademy, we have this beautiful NEET PG free test calendar. Week 4, this is the week 4 from April 18 to April 24. We have this amazing 10 p.m. series of anatomy, biochemistry, anesthesia, mix, and all this beautiful stuff. Quizzes we have. I admire if you really participate in such amazing quizzes. And normally their quiz are logged, and you have to use the code to unlock them. Use any code. Here the code is Dr. Anand. Also at the same time in the Unacademy, we have this beautiful plus subscription, and also known as iconic subscription. In the plus subscription, you get amazing access to live and recorded classes. Question banks are good. You can watch me on your iPad, on your laptop, on your Android devices. Educators are really nice, and live and test quizzes we have. In the iconic subscription, basically you get the Unacademy platform and the Prep Ladder subscription, all the amazing clinical notes, video lectures, question bank, live test, recorded classes, everything you get on the iconic subscription. That's it. And also in the Unacademy, we have this beautiful Unacademy Lite for NEET PG students. As you all know that our this thing exam is so near, so we have 90 plus grand tests. I always tell everyone to give grand test. So NEET PG, INICT, FMG, and test previous year question paper series we have. So give this grand test, it will be nice, known as Unacademy Lite. That's it. Beautiful. Let's start. For the MBBS students also, we have made this beautiful batch pertaining to next. This is the duration, 3 months, 6 months, 12 months. This is the price. This is the pre-launch price from April 20th. And also today also I had posted a DPP. What is DPP? Daily practice papers. Every day I'm gonna post in the Unacademy app daily practice papers. I want every one of you to participate. Give as many tests as possible. That's it. And doubt clarification batch is already running amazing from April 6 to May 6 with all the amazing educators and helps in the exams. Congratulations to the someone who works so hard, the FMG students. I want you all to, your names to be there on this podium. Rank 1, Osama. Rank 2, Pancake. Rank 3, the Lost Ladat. Okay. And if you're new to Unacademy, this one, download Unacademy. We have some amazing features like I can make MCQs poll. You never miss the classes because all the lectures are recorded, and you get the downloaded PDF notes which everyone wants, so it's good. That's it. And so I have already told you regarding the FMG 2022 high yield revision and MCQ batch of the 1 month, and our NEET PG subscription. I have told you the plus, the iconic, and the light. Take light and be light. That's it. Let's start this beautiful amazing class. So this, before starting any beautiful session, we always have a motivating code, and this code says you have within you right now everything you need to deal with whatever the world can throw at you. So very strong positive vibes to all of you. You have within you have the courage, the hope, the admiration, everything you have within you. You have within you right now everything you need to deal with whatever the world can throw at you. So you, हम है, बाकी पानी कम है, हम किसी से कम नहीं. We are unique, we are one, and we are super amazing than anyone else. Right or wrong? Am I right or wrong? I hope I'm right. Hello, Osama Sheikh, one of our best students always in the classes. Vandit, Manoj, Shagufta, Swaraj, and Dr. Vandit. Celiac disease. Beautiful class, simple to the point answers. Celiac disease. Can anyone please tell me? I am a PG student. I don't know what is celiac disease. How will the patient present? What should I remember for my PG exam regarding the celiac disease? Anyone? Yes, exactly. Celiac disease. The problem is it is a disease of G and G. What? Ganga and Yamuna? No. This is the disease of genes and grains. Very important. I want your strong, positive, good vibes in the class. Try to answer as much as possible. It is the disease of genes and grains. Celiac disease, it is disease of G and G. Which genes are involved? Osama, could you please tell me which gene variant is there in celiac disease, which is so important? Swaraj, doc derm, yes buddy, very good. Hey buddy, how are you? What's up? Exactly. Perfect. So nice. Osama ne moti ki tarah Osama is answering. So beautifully Osama is answering. So grains he is mentioning is barley, rice and wheat. Very good. Nice. And genes. So the genes responsible are HLA class 2 and the grains responsible are whatever it contains gluten. Whatever any product which has gluten, there is a problem in there in the celiac disease. Like if you're a newcomer, one word I should remember. If you're a newcomer to the class, one word you should always remember, that in the celiac disease there is gluten sensitivity. There is gluten sensitivity. Whatever gluten I am taking, I am sensitive to that. And I'm gonna come to the next slides also, that what all products basically gluten contains, what all things contain gluten. Deepak has come, our combat healer. Hi Deepak, what's up bro? क्या चल रहा है? दिल्ली कब आओगे? जल्दी आ जाओ. ठीक है. Now very important. Star mark. PG entrance question number 1. Patient with celiac disease have a variant of HLA genes. Everyone knows about it. So, but which variant of HLA genes? So that we have HLA-DQ2 and HLA-DQ8. DQ2 is more responsible than DQ8. Patients with celiac disease have a variant of HLA gene. There are some genes in my body known as HLA. If I'm having celiac disease, I will have a variant of this HLA gene. And which one? HLA-DQ2 and HLA-DQ8. And yes, Swaraj is already answering amazing that what is HLA? HLA is nothing but human leukocyte antigen. This class will be exquisitely only for 30 minutes. So give your best good vibes, for we are trying to make this short sessions so that your brain enters more memory and it's light for you, because after full 1 hour of class sometimes you get tired. So only 30 minutes. पता भी नहीं चलेगा टाइम कब खत्म हो गया. ठीक है. So I hope this question number 1 is very much clear to all of you. Number 1, that the patient will of celiac disease will have a variant of which gene? HLA gene. Which subtype? HLA-DQ2, HLA-DQ8, and DQ2 is more importantly responsible than DQ8, and the patient has a problem with the gluten. Okay. Now good vibes, strong positive vibes. Listen to this class. The HLA gene, listen this line very importantly. The HLA genes, they present gluten to the T cells. Listen very carefully. It's very simple and important point. The HLA genes in celiac disease, there's a variant of HLA, right? So once this variant or variation or problem or abnormality of the HLA, what does this HLA does? This HLA genes, they present the gluten to the T cells. वो ग्लूटिन को उठा के टी सेल के सामने पेश कर देते हैं. HLA gene, they presents the gluten to the T cells, and T cells are usually responsible for what? T cells basically, they function as a center cells of inflammation. Yes or no? T cells are the center cells of inflammation because they release the cytokines. So this line should be very well clear for all of us, that HLA gene, they do what? Listen very carefully, okay? This HLA gene, they do what? So this variant of HLA gene, they present the gluten to the T cells. T cells के सामने gluten को पेश कर देते हैं. T cells कौन क्या करते हैं? What is T cells? T cells basically they function as the cells of inflammatory markers, inflammation, by releasing the cytokines. So this word should be very well clear in your automatic brain. That's why this cytokines, the release of these cytokines, they precipitate a cascade, means a full journey of immune, mesenchymal as well as epithelial cell activation in the intestine. Nothing, if I tell you in a simple 10th class word, nothing, these cytokines basically, the inflammatory markers, the T cell, the cytokine, they basically cause destruction everywhere. They cause destruction in my immune process, leading to some dermatological manifestations. They also attack on my epithelial cells basically. So what basically, by attacking, what do they do? Number 1, they causes some hallmark lesions. These T cells, these inflammatory markers, basically in celiac disease cause some very bad things to my body. What are those hallmark lesions? Swaraj, Yashraj, Deepak, Shagufta, and Osama, what are those hallmark lesion my body will have if T cells will do so much of itna udham machayenge to? Number one, I will have villus atrophy. Very important. In my intestine we have normal villi, and if I'm suffering from celiac, my villus will have like problem. There'll be partial atrophy, subtotal atrophy, and total atrophy. The villi of my intestine will have atrophy. That is the first hallmark lesion I will have in a case of celiac disease. Hello Arpita Pancholi, what's up? Yes, Arpita is so right. Villus problem, villus atrophy. The second problem I will have is nothing but crypt hyperplasia, and increase in the IEL, which are nothing but intraepithelial lymphocytes. This is a very important take-home message I want you guys to take from home. Take from this class to home. That if I'm suffering from celiac disease, three big problems I will have. All those T cells which are doing a lot of inflammation and inflammatory problems that they are doing, they will, number one, they will damage my villi, leading to villus atrophy, leading to crypt hyperplasia, and also there is increase in IEL known as intraepithelial lymphocytes. So very crystal clear this point should be there. Let's have a very quick revision of the celiac. Number one, celiac disease is a disease of G and G. That is nothing but genes and grains. Genes as in nothing but HLA class 2, and grains are nothing but gluten problem is there. The HLA genes are HLA-DQ2 and HLA-DQ8, whereas DQ2 is more, the variant of DQ2 is more visible or more seen than the DQ8. And HLA is human leukocyte antigen. Also at the same time, we understood that this variant of HLA genes, what do? They present the gluten to the T cells. धक्का देके T cells के सामने खड़ा कर देते हैं. T cells क्या करते हैं? What does the T cells do? T cell basically they are the center cells of inflammation. They cause inflammatory cascade by releasing of cytokines, and these release of cytokines basically precipitate the full problem in my immune system, problem in my epithelial cells in the small intestine. What problem in the small intestine? Basically the hallmark lesions are my small intestine has a villi, they cut the villi leading to villus atrophy. They also cause some crypt hyperplasia, and also there is increase in IEL, that is intraepithelial lymphocytes. Done. Has everyone understood this much? This is the very crisp information regarding the celiac. Yeah. So let's answer the question. Yeah, see, so beautifully Dog Derm is answering. Villus atrophy, crypt hyperplasia, increase in IEL. Yes. Very good. Okay, 15 minutes left, then this class is over. Only for 30 minutes, quick class, this topic was there. Patient is sensitive to what? The answer is gluten. The patient is sensitive to gluten. The important thing I need to understand, where all the gluten is present. Can I have, number one, can I have this chapati? Yes or no? I'm going to show you the pictures. Photographic memory plays a very important thing in life. In my whole life, I've taken photos to have a very beautiful imprint picture on my mind. Can I have roti and chapati if I'm suffering from celiac? No. Wheat has gluten. The patient in celiac disease is sensitive to gluten. Can I have whole wheat chapatis? Yes or no? No, chapati nahi khana chapatis. Next important point. Beautiful cake. Can anyone please mention your favorite flavor of the cake? Pancake? Okay. Anyone likes chocolate cake? Who likes butterscotch? Please raise your hand. Please raise your hand. Who likes butterscotch? Deepak कौन सा दीपक जब आया था उधर से he got me red velvet cake. याद है दीपक? Do you remember? Do you know? Yes, exactly. Who likes? Please share your favorite flavors. So yes, we have Amrit who says Black Forest is the favorite. Okay, sounds nice. Okay. Okay, Dr. Yashraj also Black Forest. Okay, Osama likes butterscotch, cute. Okay, Arpita chocolate truffle. Even I also like dark chocolate, thick dark chocolate. Actually, my friends they like dark chocolate. और तब से मेरी इतनी बुरी आदत पड़ गई है. Only dark chocolate I like, but that too thick गंदे वाला. It's very tasty, but exactly. So Shagufta likes white forest, vanilla. V for Vandit, V for vanilla, cute. So if you are suffering from celiac, can you have such amazing cakes? Yes or no? No, you cannot have. Exactly. Yeah. JP कह रहा है वही दो तीन सब खाते हैं. That's true. So Swaraj likes chocolate. So number one, can I have chapatis if I'm suffering from celiac? No. If I am having suffering from celiac, can I say butterscotch cake? No. Any cute pastries? I love pastries. Can I please have pastries? No, 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 no. Can I have bread? I'll makhan maar ke full like a bread with the jam. Can I have? Can who likes bread with jam? Anyone? No, no, not allowed. So not allowed. What about pancake? We have a student. Her name is Pancake. Can I have pancake, please? I love vanilla वाला pancake. Even उसमें muffins भी आते हैं. इसमें एक muffin भी आता है. एक question था ना. Where do you see blueberry muffin rash? Blueberry muffin. Anyone? Osama, आगे आ जाओ. दीपक. आंसर नहीं आंसर दिया बेटा, देख तेरा घर का पता है मुझे एड्रेस. हाँ जी, दिस वन. Dr. Deepak, Dr. Osama, Arpita, Dogdom, and Vandit. Where do you see blueberry muffin rash? Anyone? Which? So beautiful. Unsuf told congenital rubella syndrome. And many other, not rubella. Congenital rubella infections. The mnemonic is cafe coffee day. Everyone knows about it. Congenital heart, PDA, cataract, and deafness being the most common manifestation. In those congenital rubella syndrome triad, the patient will have a blueberry muffin rash. This is very important in congenital rubella. And what are the eye finding? Anyone? मुझे आता ही वाला. विच इज दैट प्रॉब्लम, विच इज दैट आई इशू द पेशेंट विल हैव? ओसामा. कोई बात नहीं ओसामा, चलता है, गलती चलती है. हाँ जी, दीपक, यशराज, अर्पिता, what is that eye finding? So the answer is salt and pepper retinopathy. Have anyone heard about it? Salt and pepper retinopathy. Where do you see salt and pepper retinopathy? Cataract is there, but salt and pepper retinopathy. Do you remember this? Yes or no? Salt, namak. किसी ने ऐसे नमक, salt and pepper. Sir, I want salt and pepper on my omelette, please. Okay, yeah. So that's it. So salt and pepper. It is so beautifully Amrit Pandey has answering. So congenital rubella, that triad is cafe coffee day. Congenital heart disease, that is PDA. Then cataract and deafness being the most common manifestation. In congenital rubella, you see blueberry muffin rash and also salt and pepper retinopathy. That's it. Finish. So हमने 2-3 टॉपिक एक साथ ही खत्म हो जाते हैं. Can I have sandwiches? I like sandwich with little mayonnaise and little fat wala. No. If you're suffering from celiac, no. Pink movie. No means no. Can I have hot dog? Please, can I have hot dog? Badhiya sa makhan maar ke with little mustard. I like mustard with full of fat. Anji, no. If you're suffering from hot dog, no. If you're suffering from celiac, hot dog is not allowed. Can I have pizza? I love pizza. Pizza crust, it's very tasty. Which one is your favorite? Raise your hands. Pizza Hut or Domino's? Tell me fast. Actually many of you might be liking Domino's, but I like Pizza Hut because उसमें dining होता है, आराम से खाते हैं. So no pizza, no Domino's. So yes, so these were the various foods containing celiac, containing gluten. Pizza Hut, hot dog, sandwich, pancake, bread, this one क्या बोलूँ उसको, pastry, नहीं not chocolate, क्या ये, cake, चपातीस, wheat. ये सब नहीं खाना है आपको. रिमेंबर दैट. ओके, यस. तो इतना चक्कर खाने के बाद आई विश दैट नो वन ऑफ माई फ्रेंड्स शुड हैव celiac because it's so difficult if you can't eat all that. Okay, extra minutes, Swaraj. What are the clinical features? So can you please, beautiful, so can we have a good strong vibes in the class? If I'm suffering from celiac, which has a gluten problem, which has a problem in my small intestine, my villi, what you call villus atrophy, my villi are totally gone. What are the problems will I have? So yes, exactly, दीपक ने पर करके आंसर दिया है. वेरी गुड दीपक. सो दे आर डिवाइडेड इन टिपिकल फीचर्स एंड एटिपिकल फीचर्स. 9 more minutes, then this class is over. This was the part 1 quick discussion on celiac. Tonight at 11 p.m. I have a part 2 discussion only for 30 minutes. So if possible, come, it will be easy. See, so that your brains are little easy, that you should know. Exactly. So typical and atypical features. What are those typical features? Deepak has already told. Will I have vomiting? Yes or no? Will I have vomiting? Exactly. I will have vomiting, right? Yes. What are the various types of vomiting? Everyone knows about it. We have projectile vomiting and we have non-projectile vomiting. In general, in celiac, which type of vomiting are we expecting? Projectile or non-projectile? Like with a speed or a jet, or like a non-projectile? The answer is normally you get a non-projectile vomiting in a case of celiac. Okay, food poisoning, acute gastroenteritis, diarrhea with vomitings and all that. Non-projectile, right? Exactly. And 2 examples of projectile vomiting. Very quickly, can you please tell me? We have done this. Can you please tell me? ओसामा कह रहा है सर जब मैं पहली बार हॉट डॉग का नाम सुना तो मेरे दिमाग में अजीब सा आया कि हॉट डॉग कैसे बनता है। एग्जैक्टली हॉट डॉग। Very true, bro. Very true. Exactly. Yeah. Swaraj has already answered beautifully. A congenital hypertrophic pyloric stenosis will have a projectile vomiting, and also at the same time raise intracranial tension, meningitis. All these conditions will have a typical projectile vomiting. Perfect. Next question. So cute, so cute. कौन है ये? Who is he? I think this Osama. The patient can have constipation, like the patient can have diarrhea as well as constipation. Remember photographic memory, the patient can have even constipation can also happen. Constipation, or the patient can have diarrhea. This is our cute Osama with diarrhea, and the patient can also have vomiting. So vomiting, diarrhea, constipation. Most importantly, such a beautiful picture. Can anyone please tell me what is this picture of? क्या कमेंट करेंगे? This was the FMG question actually. If this picture comes, what will you write? Of course, I can appreciate this baby is a case of SAM. What is SAM? Severe acute malnutrition. Have you heard of the fatty baby known as kwashiorkor? Yes or no? And have you heard the skinny baby, the skinny सूखा बच्चा, skinny baby known as marasmus? Yes or no? But remember, like in general, I'm saying a patient of celiac disease will have a features of FTT. What is FTT? Failure to thrive. Failure to thrive. The patient of celiac disease will have features of failure to thrive. Failure to thrive. Doctor, my baby is not gaining weight. Doctor, my baby is not getting height. Not gaining height. Doctor, my baby is not growing as compared to the other siblings. That's how the PG question comes. Hello everyone. Hello, hello, hello. Anji, that's how the PG question will come. Okay, a 2-year-old child, mother complaints, baby not gaining weight and height, having severe vomiting, and alternate episodes of diarrhea and constipation. So your mind should jump, and think, oh, this could be a celiac disease. Let me investigate. समझ में आ रहा है everyone? 5 more minutes, then this class is over. Please give me a quick like on this video if you are able to understand. 30 minutes तो ऐसे ही हो गए, खत्म ही हो गए। बातों में टाइम खत्म। Is everyone understanding? Perfect. Let's start. Yes, the patient can have failure to thrive, the patient can have pain abdomen and all this. So yeah, can we have a quick revision? Yes, the clinical features of the celiac disease have typical and atypical. In the typical features, vomiting, diarrhea, constipation, failure to thrive, FTT failure to thrive, and पेन एब्डोमेन। ठीक है, एग्जैक्टली इसको देख के मुझे एक चीज याद आती है। टी से कुछ नाम होता है। बाय लुकिंग एट दिस पिक्चर, कैन वी प्लीज टेल समथिंग नोन एज समथिंग स्टार्ट्स फ्रॉम टी? यस और नो? शगुफ्ता, डॉग डर्म। व्हाट इज योर नेम? डॉग डर्म। डॉग डर्म। अर्पिता, मनोज चौधरी। एग्जैक्टली ये टी से क्या होता है? शक्ल देख के व्हाट इज दिस टी थिंग? प्लीज टेल मी। हैव यू हर्ड ऑफ टेनेस्मस? यस और नो? Tenesmus. Have you heard of tenesmus? Pain while passing stool, or the proper definition is incomplete evacuation of bowel. Incomplete evacuation of not bladder, bowel. ठीक है, bowel. ठीक है. Have you heard of tenesmus? अच्छा, if you have heard about it, फिर बताया क्यों नहीं? फिर जब पूछा तो फिर मैंने सुना है, मैंने कहीं पढ़ा था, मैंने टेनेस्मस, तो फिर ऐसे yes exactly. So tenesmus, the nothing but patient will have incomplete evacuation of bowel. potty करने में प्रॉब्लम होगी, and the patient have pain. Pain. I should be an actor actually. Sometimes I feel I should be a model also. Okay, great. Done. Next point. Yes. 4 more minutes, then this class is over. This was the first half of celiac. Tonight 11 p.m. on the same Unacademy, beautiful Unacademy NEET PG platform, Conquer NEET PG, we're gonna have a part 2 of the celiac. Just 4 minutes left. Let's see. Hanji, बार जाना. Hanji, very good, Dr. Yashraj. बार जाना. Which is more common in a patient of celiac disease? Option number A or B. What do you think? Intestinal manifestations are more common, or extra intestinal manifestations are more common? What do you think? Tell me fast. Dr. Osama. Divya has answered beautifully. Divya, very good. extra intestinal manifestations. So we have someone who says A, but bro, remember, extra लगता बहुत आसान है कि patient को vomiting, diarrhea, this, that, typical features. But according to the book, which is more common in a patient of celiac, the patient will come to you extra intestinal manifestation. Can you please tell me a very important PG question, which is the most common, which is the most common extra intestinal manifestation of a celiac disease? Who will tell me? Please, 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 please. Okay, so Raj says you are all rounder, sir. Best teacher, best singer, best mentor, and many, many more. Yes, bro, I'm nothing without your support. We all are one. I was born to teach. We all should have a reason for existence. मेरी बात को याद रखना. अभी तो चलो you study for PG. Once you get a rank 1, then think about this one day. What is the reason for your existence? Shreya Ghoshal has born to sing. Sonu Nigam has born to sing. Some people has born to play rugby, and I have born to eat. I love eating, to be happy, and to inspire and to teach. This is my reason for existence. What is your reason for existence? Yeah. Okay, Swaraj. Okay, dear. Yeah, the best answer has been given by Osama Sheikh. The most common, the patient of celiac will have vomiting, diarrhea, not gaining weight, not gaining height. So all these problem will lead to iron deficiency anemia. That is the typical, beautiful, most important answer of what is the most common extra intestinal manifestation of celiac disease. The patient will come to you with a case of iron deficiency anemia. Are you understanding? Hello everyone. The patient, like, mother complains, the baby not gaining weight, not gaining height, vomiting and all. The following lab investigations are attached. Please give your best diagnosis. The following lab investigation will be the features of iron deficiency anemia. Exactly. Yes, yes, that's beautiful. Nuclear briefcase. So what is the peripheral blood smear finding of iron deficiency anemia? Recently we had some amazing class with Dr. Priyanka and me. We discussed about iron deficiency anemia in depth and detail. Could you please tell me could you please tell me what are the hematological microbiological findings of iron deficiency anemia? Anyone? Exactly, Divya is right. The patient will have a microcytic hypochromic anemia. Number one. Can the patient will have target cells? Yes. The patient will have, क्या बोलते हैं उसको, anisopoikilocytosis, anisopoikilocytosis, right? One more thing, and here only let me ask you back to back, how do you differentiate iron deficiency anemia from thalassemia? Who will tell me? Let me ask you some full integrated question. How do you differentiate iron deficiency anemia from thalassemia? Anji, true. The best answer is, have you heard of Menzer index? Exactly. What is the formula for Menzer index? Anyone? What is the formula for Menzer index? Who will tell me? Dash by dash into 100. Yeah, Osama, huh? So, yes, very good. So, M for Menzer, M for MCV. Upon, see, for the first letter of the Menzer is M. So, means MCV. Thus, last letter of the Menzer is R, nothing but RBC. So, MCV upon RBC into 100. MCV upon RBC into 100. That is the Menzer index. And how do you differentiate? Who will tell me? Exactly. Divya is okay, no problem. Divya, you're answering very well. So less than 13, if the Menzer index is, the patient will is suffering from thalassemia. How will I remember, sir? Thalassemia. Less than 13. Less than 13 will be, if the Menzer index is less than 13, the patient will have less. What less? Thalassemia. Thalassemia is less. And the patient has Menzer index more than 13, then the patient is suffering from iron deficiency anemia. Very important. Yes, exactly. Yes, sir. आज ओसामा का नाम 100 time cross, sir. Okay, Surjana is counting how many times he has spoken. Osama is our, I'd frankly tell you, Surjana, Dr. Osama Sheikh, we met him through this Unacademy platform only, and he has not missed even a single class of mine. And I have to tell that his IQ and his way of answering has improved 10 folds. You know, in the beginning he was answering very, very less, very, very less, and today he see like this, like this, like this is answering. Why? Consistency is the key. Tomorrow I will tell your name also. Srujana, 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 Srujana. Then Osama will tell, you are telling Srujana name 100 times. What is this? Okay? That you should know. That finishes this part. And yeah, can anyone please tell me, like, how do you differentiate iron deficiency anemia from thalassemia? You told me Menzer index. How do you differentiate iron deficiency anemia from anemia of chronic disease? Who will tell me? How do you differentiate iron deficiency anemia from anemia of chronic disease? Very nice question. Very nice question. Tell me fast. We're gonna end this class. 30 minutes are over. This class is finished now. Last question. How do you differentiate iron deficiency anemia from anemia of chronic disease? You sure? थोड़ा सा और TIBC ठीक है. TIBC तो या हाँ. So क्या नाम है? Unsuf. Nice name. Unsuf is right. Let me have a picture here. खाली चीज कहाँ है? 1 second. Yeah. So see, iron deficiency anemia and anemia of chronic disease. Everyone knows in the iron deficiency anemia, serum ferritin. What happens to serum ferritin in iron deficiency anemia? Obviously, it decreases. And once the serum iron and serum ferritin decreases, that they call to the company name is TIBC. What is TIBC? Total iron binding capacity. Serum ferritin people call the TIBC people to make more and more iron, more and more iron. So TIBC increases and serum ferritin decreases in a case of iron deficiency anemia. I totally agree with you. So my question was chronic anemia of chronic disease. Chronic. I am having osteomyelitis actually. I'm having chronic TB I have chronic disease, celiac, any inflammatory bowel, any chronic problem. The inflammatory marker of any chronic illness is serum ferritin. This is what you have to answer me, okay? Of course, TIBC you can tell, but ये समझ रहे हो ना? The inflammatory marker of chronic illnesses is serum ferritin. So if I'm having chronic disease or osteomyelitis, my serum ferritin will increase. So increase serum ferritin will be there, and the serum ferritin will call the TIBC people ke baba, we are too much, please decrease our production. So total iron binding capacity will decrease. So the differentiating points of iron deficiency anemia from chronic anemia of chronic disease is serum ferritin decreases in iron deficiency anemia, whereas in anemia of chronic disease it increases. This is very important point. And uska ulta kya hai? TIBC. And Menzer index is not used for differentiating iron deficiency anemia from chronic anemia of chronic disease. They are Menzer index is for differentiating iron deficiency anemia from thalassemia. Less than 13 is Menzer index, less than 13 is thalassemia. If a patient has Menzer index more than 13, means the patient is having iron deficiency anemia. Has everyone understood this much? Let me know. Exactly. ट्रांसफेरेंट रिसेप्टर का इतना नहीं होता, बट ये मार्कर, ये जो बताया, ये टॉप क्लास पॉइंट है. रिमेंबर दैट. हैज एवरीवन अंडरस्टूड? प्लीज पुट अ लाइक बटन टू दिस वीडियो. हैज एवरीवन अंडरस्टूड? समझ में आया या दिमाग के ऊपर से गया? अगर ये दिमाग के ऊपर से गया, यू शुड गो टू टेम्पल, हनुमान टेम्पल. यू कैन गो, यू कैन ईट 5 almonds in a day and 1 spoon of च्यवनप्राश and 1 spoon of honey. That's it. Okay, very good. Thank you so much everyone. That finishes the first half of the class. 11 p.m. tonight. 11 p.m. tonight. Come again for quick 30 minutes, 25 to 30 minutes. We're gonna finish the second half of celiac, where I'm gonna talk about something, this amazing stuff of dermatitis herpetiformis. I'm gonna show you some amazing pictures of what are the other problems these babies can have, CNS findings, and most importantly, what kind of diarrhea you will have. How should I test these patients? What is TTG? What is EMA? And what is this Marsh-Oberhuber classification? What are the duodenal findings in a case of celiac? And last but not the least, treatment. What is allowed, what is not allowed. So we're gonna talk about this tonight, 11 p.m. on our amazing YouTube channel, Conquer NEET PG. And thank you so much everyone for this wonderful participation. Come tonight, this one at 11 p.m. and before leaving, we always have a motivating quote, and this beautiful motivating quote, one of my junior Dr. Savan has shared with me. It's one of the very nice quote. Please read this quote with me. Sometimes when you are in a dark place, you think you have been buried, but actually you have been planted. It's a very beautiful quote. Sometimes when you are in a dark place, you think you have been buried, but actually you have been planted. Planted to be strong, planted to be amazing, planted to have another vision of life altogether, planted to be strong, planted to be yourself, planted to do everything possible on this planet. Right? Am I right or wrong? That's great. Thank you so much, everyone. Have a wonderful evening ahead. See you tonight at 11 p.m. on our same YouTube channel tonight on the second half of celiac disease. Bye bye. When can a baby say bye bye? A baby can say bye bye by 9 months.